कोमल 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 हेलो 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 या
Hello, sir.
நிதிலட்சுமி
Sir, yes, sir. Voice is audible, sir.
வாய்ஸ் இஸ் ஆடிபிள் மேடம் ஜாயின் பண்ண முடியல பாருங்க
Okay, sir.
மேக் இட் பாசிபிள் விக்கெட் பண்ணுங்க ஒரு 3-4 பேர் சீக்கிரம் மேடம் வெயிட் பண்றாங்க யூடியூப் வர சொல்லு நிதிலட்சுமி கோமல்
Yes,
Sir,
sir.
yes, sir.
மேடம் இஸ் வெயிட்டிங் அவுட் சைட்
Yes, sir. Yes, sir.
அவுட் சைட் ರಾಜ್ಕುಮಾರ್ ಸರ್ ಬರ್ತಾರಾ ರಾಜ್ಕುಮಾರ್ ಸರ್ ರಾಜ್ಕುಮಾರ್ ಸರ್
Sir, he will be joining, sir.
கோமல் கோமல் Komal,
Yes, sir. Yes, sir.
madam joined.
Just checking out. No, sir.
Call somebody, Komal.
Yes, sir. I'll communicate, sir.
Please leave the place here. Leave the place, 2-3 places.
Yes, sir. We have informed, sir. Yes, sir.
No, still
Students still. Yes, sir.
don't allow them. Let them come to YouTube. Is it no? Please direct them. Group. Madam, still she is waiting outside. So, check.
Yes, sir. Ma'am has joined, sir.
Madam, good evening, madam. Hello. Hello.
Hello, sir.
Good evening. Sorry to
Good evening.
sorry.
Finally, we can do it.
Sorry, madam.
No, it's okay. It's okay.
Good evening, madam. Please welcome.
Good afternoon, sir.
We connected YouTube also. We joined now. Rajkumar sir.
Yes, sir. Sir joined, sir.
Okay. Rajkumar sir.
Good afternoon.
Good afternoon, sir.
Good afternoon, sir.
Sir.
Komal.
Sir, with your permission, shall we begin the program, sir?
Yes, Komal.
Sir, shall we begin the meeting, sir? Shall we begin the webinar? Sir?
Yes, Komal.
Okay, sir. Yes, sir. A warm good afternoon to all present here. We cannot live by ourselves. 1,000 fibers connects us with our fellow men. Herman Melville. With this beautiful quote, I introduce myself, Komal S., respected speaker, principal sir, staff, students, and participants. A warm welcome to you all for this webinar. Faculty of Pharmacy, Dr. MGR Education and Research Institute has been successfully organizing series of national and international webinars and FPP with eminent speakers from all over the globe with a vision to intensify the intellectual wealth to the students, faculty, research scholar, industrialists, and pharmacists. In continuation with the events conducted, Faculty of Pharmacy, Dr. MGR Education and Research Institute, in association with NSS, Dr. MGR Education Research Institute is organizing this national webinar to discuss on a social and honorable system of organ donation. The topic of today's program is a sensitization session on organ donation by Dr. Hemal Kanvinde.
Finally, ABC.
Hemal Kanvinde, Quality Assurance Officer, Mohan Foundation, Chennai. So let's gain knowledge in this extremely interesting topic. A recorded version of this webinar will be available in our YouTube channel named Principal Pharmacy. You can subscribe to this channel for regular updates of webinars and information. Moving on to our session, may I now request Mrs. Gajalakshmi Ma'am, Vice Principal, to introduce and give introductory address to the session. Over to you, ma'am.
Thank you, Mrs. Komal ma'am. A warm good evening to one and all. I gladly welcome you all for this webinar on most interesting title, a sensitization session on organ donation, delivered by Dr. Hemal Kanvinde, Quality Assurance Officer, Mohan Foundation. On this auspicious evening, I would like to thank our management, Founder Chancellor, Dr. A.C. Shanmugam sir, Honorable President, Engineer A.C.S. Arun Kumar sir, Honorable Secretary to A. Ravi Kumar sir, and Dr. Rajkumar sir, Program Coordinator for NSS, for their active interest and involvement to conduct this webinar at Faculty of Pharmacy, Dr. MGR Education and Research Institute, in association with National Service Scheme. With great joy and immense exultation, I feel privileged to extend my warm welcome to everyone here for the conduction of webinar on topic, a sensitization session on organ donation. Almost every successful person begins with two beliefs: the future can be better than the present, and I have the power to make it so. We cordially invite all the professionals, scholars, academicians, and industrialists to be part of this tremendous webinar. The aim of this webinar is to access the awareness and attitudes regarding organ donation among the population. Organ transplantation is the most preferred treatment for many of the end-stage organ disease, as it offers a better quality of life and has a better long-term survival benefits. However, primary hindrance to the organ transplantation program worldwide is the shortage of donor organs. There is an increasing discrepancy between the number of patients on the waiting list for the organ transplantation and the available number of deceased donor organs. Although the public is accustomed to blood donation, there is largely hesitation among organ donation. For the success of the organ donation program, positive attitude of the public towards the organ donation and the consent by the relatives for organ donation in the event of brain death are required. With the rhythmic quotes, come ahead and take part in saving life. Let us gather you all for this awaiting webinar. In this juncture, I would like to share the vision and mission of Faculty of Pharmacy. Vision of our department focuses to accredize the intellectual knowledge and skill among the students through imparting good quality education and excellent technical skills among the students hailing from the rural areas. On the other hand, vision pioneers for the eminence in imparting knowledge with human face and creating an amicable atmosphere where students, teachers, and organization can grow together in synchronization for their mutual benefits with the larger picture of an educated and well-meaning society belonging to all sections in the background. Implanting the seeds of discipline and professionalism among the faculty and students, inculcate the knowledge of education and research deep into the inquisitive minds of students, making our students with the motto of job creators, not job seekers. Now it's time to introduce our beloved principal, sir, who is the captain of Faculty of Pharmacy, a great team leader, an affordable human being, Dr. N. Harikrishnan, sir, who stands behind all our endeavors at Faculty of Pharmacy crowd. I welcome you all. Thank you, Komal ma'am.
Thank you, ma'am. May I now request our principal, Dr. N. Harikrishnan, sir, to deliver the welcome address. Over to you, sir.
Professor, kindly unmute.
A good evening and welcome to all faculties and students to this webinar on sensitization session on organ donation. Faculty of Pharmacy is a constituent unit under the most esteemed and well-regarded flagship of Dr. MGR Educational and Research Institute, and it strives at imparting quality and training to the future pharmacists of this country, who would play a promising role in the healthcare system. So at outset, I would like to thank to Dr. Hemal, Quality Assurance Officer, Morgan Foundation, who heartedly accepted our proposal to organize this event associated with the NSS. With their extended support, this event has transferred magnificent experience. I would like to extend my sincere thanks to Dr. Rajkumar, NSS Coordinator, Educational Research Institute. Thank you for the support, sir. In this moment, I take the opportunity to thank our management, so who has been source of inspiration and support in all the prophetic accomplishment of Faculty of Pharmacy. I extend my welcome to our respected Vice Chancellor, Madam, Professor Dr. S. Geethalakshmi, who has joined us today, and thank her for all her guidance and support in our all efforts. So actually, this program completely this is in India. The shortage of organs is virtually a universal problem, but Asia lags behind much of the rest of the world. It lags far behind other countries, even in Asia. It is not that there are not enough organs to transplant. So merely some who dies naturally, or in the accident, or in the potential donor. Even then, invulnerable patients cannot find a donor. What is the situation and shortage of organs in India? So there is a wide gap between patients who need transplant and the organs that are available in India. An estimated around 1.8 lakh persons suffer from the renal failure. However, the number of renal transplantation is done around only 6,000. And the next one, an estimated 2 lakh patients die of liver failure or liver cancer annually in India, about 10 to 15% of which can be saved with a family liver transplant. Hence, about 25 to 30%, like 25 to 30,000 liver transplants are needed annually in India, but only 1,500 are being performed so far. So similarly, about 50,000 persons suffer from heart failure annually, but only about 10 to 15% heart transplants are performed every year in India. In case of cornea, about 25,000 transplants are done every year against a requirement of 1 lakh. So we are fortunate to have a leading, inspiring guest like Madam, so who strive to make every attempt to the betterment of the public, and the donors. And completely, this program is creating the awareness towards the organ donation. I once again welcome all the dignitaries and the participants and students and faculties to this event. So make use of it to the human community. Thank you very much for the. Thank you, Madam. Thank you.
Thank you, sir. May I now request Dr. P.S. Rajkumar, sir, Professor, CSA and Program Coordinator, NSS, Dr. MGR Education Research Institute, Madurai, to deliver the special address. Over to you, sir.
Good evening to one and all present here. First of all, I am very glad to participate in this special virtual meeting seminar organized by the Faculty of Pharmacy in associated with the NSS. Whenever the government order or special event to be conducted from ACS Medical College campus, pharmacy faculty, they come forward each and every event. Similarly, I want to tell about our principal sir. He voluntarily came and give the topic and fixed he himself with a special team that Hema madam organized, and just informed before 1 week that special team having by the Faculty of Pharmacy. So this is a special day, but anyhow, the speaker wants to talk, wants to give more information about organ donation. Anyhow, as a part of NSS, I would like to give some information. It is a glorious evening to see you all in this gathering. I extend my warm welcome on behalf of NSS wing of Dr. MGR Educational Research Institute, Chennai. Organ donation is a social act by brain dead or living donor. Few common ones: kidney, liver, intestine, heart, bone marrow, and lungs. Organ donation in India is controlled by Human Organ Act 1994. In Western country, it is in higher rate when compared to India. NOTTO, National Organ and Tissue Transplantation Organization, governs organ donation in a systematic and legal process. There are many inspirational stories of people who donated these organs when they were near death door. Organ donation is a noble act that could give a ray of hope to another people's life. Before we begin this event, I wish to express my gratitude to all of you who sincerely committed to this event to make it success. This event would have been impossible without the support of each and every one present here. I feel proud to welcome Dr. Hema ma'am, Quality Assurance Officer, to deliver the special talk about organ donation. Sincere thanks to principal and team of Faculty of Pharmacy. Thank you one and all. Over to Komal ma'am.
Thank you, sir. Thank you very much.
Thank you, sir. May I now request Dr. C.N. Hemalata ma'am, Associate Professor, to introduce the chief guest to us.
Good evening to one and all. Warm welcome for today's events. Dr. Hema Kanvandi had completed MSc in Life Sciences and PhD in Ecology. She had experiences in managing national and international research projects dealing with biodiversity, coastal ecology, and sustainable livelihoods. She has a working and practical knowledge of social and gender issues. In 2011, she trained as a transplant coordinator at the Mohan Foundation in Chennai. She has been a faculty member for transplant coordinators training for teaching national and international transplant law She has assisted in organizing and planning medical and nursing training workshops on brain death and diseased organ donation. At present, she is a quality assurance officer of Mohan Foundation and is responsible for the running of a national helpline on organ donation. She is also responsible for public engagement, ambassadors, life members, and interns. Her work on organ donation has been published and been presented at national and international conferences. She is also the trustee of Golden Butterflies, an NGO that works for children's palliative care in Chennai. Warm welcome to you, ma'am. Thank you, ma'am. Over to you.
Shall I start?
Thank you, ma'am. Yes, ma'am. Sure, ma'am.
Okay.
Without any further ado, I would like to welcome the speaker of today's webinar to deliver the talk. Over to you, ma'am.
Thank you so much. I'll share my screen. Please check. Okay.
Yes, ma'am.
Can you see it?
Yes, ma'am. We are able
Can
to.
you hear me?
Yes, ma'am.
Okay, okay. At the start, I would like to thank the Faculty of Pharmacy, especially Dr. Harikrishnan and Dr. Rajkumar, NSS coordinator, for organizing this event on such a beautiful afternoon. I hope it is interesting for all of you and all of you take, support the cause, because we come in contact with a lot of patients who are in need of organ donation, and generating awareness and removing myths will help a lot to promote the cause. So thank you once again. We have made a Google form for you to fill up, for all the participants to fill up. So ma'am, just share the form on the chat. Once you fill up the form, then I will start the talk. Okay? Thank you so much. Please share the Google form link on the chat, ma'am.
Yes, ma'am, we will share that.
Till then, I will start. So why do we need organ donation? These are some of our heroes, because at the start, we must think about people who have been able to become organ donors and save other people's lives. These are young people, as you can see. The first picture is of Master Hitendran. Many years ago in 1996, he passed away, and his parents, Dr. Ashokan and Dr. Gitanjali, agreed to do the donation of this child's organs. And this became a big event and very much publicized event in Tamil Nadu. And that is why we always take his name before we start any event, because he was the one who actually initiated a general awareness on organ donation and the goodness of donation. You could see that all of them are so young, and you can imagine the parents' plights when they have to give their consent for organ donation. Why do we need organ donation? In 2017, the Lancet study did a study in India called Nation Within a Nation, and it showed that the common most leading cause of death was non-communicable diseases. And this is the reason why there are many people who require organs to survive. And this is the reason that we need so many organs, and there's such a huge gap, as mentioned by both Dr. Rajkumar and Dr. Ramakrishnan. There is a silent medical calamity. This picture of a tsunami, this is nearly 400 years old, by a Japanese artist. When the tsunami hit us, most of you may not even been born or may have been small children. This, when it happened, there were 2 lakh patients who died, people who died during the tsunami, and we still remember it is still in our living memory. But there are 2 lakh patients needing a kidney, and we don't have any talk about them in any media or in any newspaper, in any articles. They are not mentioned. It's a quiet calamity that is happening to us. Similarly, you can see the number of patients waiting for other organs also. We require 150,000 corneas annually. so that there is nobody who cannot see because of cornea impairment. This can easily be done if every person who passes away talks about the donation and his family agrees to donate. So there will be no shortage of cornea in our country. Countries like Sri Lanka, they export corneas, and we should be able to do that also. Going further, what is organ donation? Organ donation is the removing and transplanting of an organ or a tissue from a living or dead person into a patient who's called the recipient. It's very simple. Excuse me. So who can be a donor and what can be donated? That is the first thing that we should know. Who can be a donor? Every person can be a donor. Every person can pledge to be organ donor. Okay? Donors are of two varieties. They are living donors and deceased donors. A living person can donate and a deceased person also can donate something or the other. Non-living person, according to the act that Dr. Rajkumar said, that there is a related and unrelated category. Related category among living donors are parents, spouse, siblings, and children. So suppose I need a kidney or I need an organ. For my related donations, my spouse, my children, adult children can donate to me. There is a legal process for it. Unrelated donors are my cousins, my in-laws, my old friends. All of these people can donate to me. They come under the unrelated category. And that category has much more legal formal work to be done. So now death is of two types. Most of you would have heard of brain death also. Death is of two types. Circulatory death and brain death. Let us see what you can donate while you are living. One, kidney, blood, bone marrow, part of liver, pancreas, and part of lungs. This can be donated when you are living. Suppose a person is diseased. The deceased person dies due to circulatory death or brain death. What can they donate? Post-circulatory death, that is what we call as natural death, death at home, heart attack, when our blood circulation stops. That is called as circulatory death. We are able to donate corneas, skin, and heart valves. We are not able to donate organs unless it is a highly monitored death. Under very strict conditions, donation after circulatory death is possible. And this is also done in many countries. But in India, it is not so much practiced right now. So after brain death, what can we donate? A person can become multiple organ donor after brain death. These are the organs and tissues that they can donate and save other people's life, provided the person is brain dead. Second, certified as brain dead. Third, family consent is taken. So in case you do decide to be a donor and you want to pledge for organ donation, that is not enough. You really need to tell your family and friends about your wish. Because at time when there is death, nobody remembers, unless you have spoken about it. So let's go and understand a little bit about brain death. Okay? I hope all of you have taken the link and you have filled the form because I'll need it after 15 minutes. I would really wish that you have filled the form. Legally, the term brain death is a stage at which all the permanent and irreversible has ceased. The brain stem cannot function. It is irreversible damage. There are three pictures that I have shown here. One is a normal brain, one is a brain dead, and one is coma. It's a complete difference between coma and brain dead. In coma, the brain stem is functioning. In brain dead, the brain stem is not functioning. Nobody can come back to life if the brain stem stops functioning, and it is irreversible. But in a hospital, when a patient is in the brain death stage, he looks like a coma patient. That is why I have put this picture that you clearly understand what is coma and what is brain death. Okay? What are the causes of brain death? Most important cause is road traffic accidents. These are due to speeding, fog. Now it is distracted driving. Just want to remind you that having your phone with you is not a boon when you are driving. because you have more than 160,000 people who died due to road traffic accidents. You don't want to lose your life like that. Drinking is also a cause for road traffic accidents. So please be safe, wear your helmet, do not end up in hospital with accidents. We do not want that from all of you youngsters. I request ma'am to share the video now. Just a little introduction to brain death. When there is a brain injury, the brain swells up, there's no space to expand, and therefore there is a pressure on the base of the brain. The brain, this pressure is so much that the blood cannot come to the brain, and therefore you have ischemic shock or there is injury. And when the brain doesn't get oxygenated blood, it dies. And at this stage only, it is called as brain death. There are 4 doctors who certify brain death. And there are multiple tests to be done to certification of brain death. After they certify brain death, the patient is declared as dead. Okay. I'll stop sharing, ma'am. You just start the video.
Yes, ma'am.
Thank you so much. Yes, this video. Shall I try it? Shall I try it, ma'am? Can't hear it. Can't hear the audio.
Yes, ma'am, we will check. Ma'am.
I can try from my end about this.
I am Dr. Sandeep Vash, and I have been a practicing neurosurgeon for the past 20 years. Over the next 5 minutes, I shall explain what brain death is. Brain death or neurological death is a term not well understood by the public. People tend to confuse brain death with coma. This animation will explain what brain death is and how it is substantially different from coma. Let us start by understanding anatomy. The brain consists of two parts, the cortex and the brainstem. The cortex is the larger part of the brain and the brainstem is the smaller. The brainstem is actually the top of the spinal cord. The cortex controls higher functioning activities such as reading, writing, and talking. If the cortex is seriously damaged, the person might enter coma and lose consciousness. But even in coma, a person might still feel pain or respond to stimuli. And sometimes a comatose patient might regain consciousness. Brain death is, however, different from coma. It's a term used to describe the whole brain dying, both the cortex and the brainstem. The brainstem is the central nervous system of the human body and the center of consciousness. If the brainstem dies, respiration would stop. Once the heart stops receiving oxygen, it too would die and stop beating, and all other organs will also die due to oxygen deprivation. How does brain death occur? If a person receives a serious blow to the head or has a major stroke, the brain might begin to swell. Since the skull is made of hard bone, it doesn't allow the brain to expand. Physicians can try medication or surgery to reduce the swelling, but if this does not succeed, the pressure on the brain can grow greater than the pressure of the beating heart. Once this happens, the heart can no longer force oxygenated blood into the brain. With no supply to the brain cells die due to the lack of oxygen. In fact, the cells don't just die. A process called lysis begins where cells begin to liquefy. This liquefaction makes the brain death irreversible. Once the brainstem dies, the person stops breathing and the heart and the rest of the organs die due to oxygen deprivation. So how do we know the brainstem has died? Modern medicine has lots of ways to determine if the brainstem has died. One way is to check for the neurological activities that the brainstem controls. If the person is not conscious, cannot breathe, cannot swallow or cough, pupils do not respond to light, these are all signs the brainstem has died. In India, the Transplantation of Human Organs Act of 1994 specifies a series of tests that need to be performed by a team of 4 doctors before brain death is declared. The tests are performed twice with an interval of 6 hours. But how is it possible for the heart of a brain dead patient to keep beating? Where does the heart get oxygen from? The patient has been put on a ventilator to help him breathe. Afterwards, the brainstem dies. Even though the brainstem is dead and the lungs no longer function, the heart continues to beat because it is artificially being supplied oxygen from the ventilator. If the brainstem and the rest of the brain is dead, what is instructing the heart to beat? The heart is independent of the brain and is simply an automatic pump. As long as the heart gets oxygen from the ventilator, it will continue beating for a short period of time. After the onset of brain death, if the deceased is left on the ventilator, how long would the dead body's heart continue to beat? The heart can beat for a few more hours, sometimes even a few weeks. On an average, the heart would beat for 2 or 3 days and then die. Brainstem death is death. It is irreversible and systemic failure of all organs is inevitable. No one has ever woken up from brain death. If brain death means the patient has died, why does the body feel warm to the touch and looks like it's sleeping? The human being, the organism, is dead, but the organs, such as the heart, are kept alive for a few more days, giving the appearance of a sleeping person. An organ can be kept alive even outside the body by giving it oxygen. But the person is dead once the brain is dead. A brain dead patient is not a person suffering from brain death. He is dead. Once death has been established, the question facing the family in that situation is what to do. Should the family wait till their loved one's heart stops beating? Or should they express their wish to donate organs and save other people's lives? Emotionally, it's a difficult choice, and every family has to do what they feel is right.
Thank you, ma'am, for sharing the video. Can everybody hear me?
Yes, ma'am.
Okay. So we'll go ahead now that brain death has been explained, and if you have any queries, you can just ask me at the end of the talk. So now we go to the law and the process of organ donation. The Transplantation of Human Organs Act was enacted in 1994 and amended in 2011. Apart from that, we have state government orders, regulations, as well as hospital regulations and protocols under which everybody functions to transplant or donate an organ. The main part of the TOA Act was to define brain death and how to determine death. How do the doctors know and how do they determine what test do they carry? That is clearly stated in the Act. So the doctors do not fear to do this. Also, to regulate removal, storage, transplantation of all human organs and tissues, all of that is also done under this TOA Act. It also has serious punishments for people who want to do trade in organ donation. Also, it regulates all the tissue banks as well as transplant hospitals. So, because of this act, let us just look at the offenses and penalties. To submit false documents, most of the illegal activities in organ donation and transplantation happen in the living donation area, not in the disease donation area. So when you have submitting false documents, person who's not my daughter says she's my daughter, that is false documentation. Commercial dealing, because this false daughter is giving me an organ, I pay her maybe in cash or a piece of land or a job or something, which is not allowed in the law. If the doctors carried out such activities which are illegal as per the Act, then their name will be struck off permanently from the register, medical register. Okay. So these are some of the offenses and penalties. Who are the statutory bodies that work for organ donation and transplantation? According to the Act, there is an authorization committee which authorizes the donation of organs, basically from unrelated category, but the hospitals will have their own authorization committee for a living donation from the related category. I need an organ, my daughter gives it, my spouse gives it, then it will be authorized within the hospital. But if some cousin gives it or some in-law gives it, it is authorized by the state authorization committee. Appropriate authority is something every state has got, which is determines the registration, re-registration, everything regarding the tissue banks as well as organ transplant centers. It also empanels doctors to certify brain death. Not all doctors are allowed to certify brain death. There are specific doctors, intensivists, neurologists, neurosurgeons, treating doctors. They are the ones who are empaneled by the appropriate authority. If in a hospital where you work, you have a brain death case, not all doctors are allowed to certify. The ones that are empaneled by this authority can come and certify death. Then there is a state authority. In Tamil Nadu, there is a state authority called TransTan, Transplant Authority of Tamil Nadu. It is in Omandurar Multi-Speciality Center. And there, they maintain the patient waiting list. Like me, if I have a kidney failure and I am on the waiting list, I register myself as a patient in a hospital, I get a waiting number. This entire patient waiting list is maintained by the state authority. Right now on the wait list, there are more than 6,000 patients waiting only for kidney transplant. So a lot of people waiting, and we hardly have 100 donors a year. So you can imagine the amount of wait that a person has to undergo till they get a transplant. Also, they develop criteria for organ allocation. They are responsible for allocation of organs. Suppose in my hospital, there is a deceased donor, and I tell the state authority that I have a deceased donor in my hospital, X blood group, this is the weight of the patient, this is the size, and this is the age of the patient. Then based on certain criteria, they will do the organ allocation. Any hospital that has a donor, one organ will always go to the government hospital wait list. This is how the waiting list is and organ allocation is done. So please do not worry that only rich people will get organs. This is not how it happens. Most of the time, one organ is always shared with the government waiting list patients on the government hospitals. So to do all this work, there are certain forms, which are the legal forms that a patient caregiver, transplant coordinator, hospitals have to fill up. There are special forms for disease donations, other forms for living donations, and special forms for tissue bank and registration of and re-registration or renewal of registration. All of these are forms. So under this act and all of this, this is how the organ transplantation works in our state. Let's go to myths and facts. Ma'am, you have the results of the Google link. You can show it on later also. You just get it ready in the meantime. I will go through the myths and facts. So while you were asked to come to this talk, to come to this seminar, or you were given an information that such a seminar is happening, a lot of you would have had some thoughts in your mind. Why should I come for this seminar? People just take away the organs. Organs are sold. So many things are there in your mind or in the mind of the community. We are part of a community. So what we think, also others will also think. So some of the main myths and facts that people think about when they think of organ donation is, if my family agrees to donation, the doctors will not save the patient. Now, do you agree or not agree? Another is donor family will have to pay for the donation in the hospital. So the first thing is, the doctors will not save the patient. The patient is already brain dead. The doctors have tried their level best to save the patient. After he comes to the hospital with a head injury or a head trauma, he goes to the emergency, then he goes into neuro ICU, and over there, he deteriorates into brain death. So it is not that the doctors will not try to save the patient. That is completely not. The donor family does not have to pay any cost of the donation to the patient, to the hospital. Once the patient is certified as dead and the family gives the legal consent, there may be time for patient to be on a ventilator. There may be some medicines given for all the organs to keep on functioning. Certain cases, there is expense, but that expense is not put on the donor family. What if I recover from brain death? After Dr. Sandeep Vaish's video, do you believe that you can recover from brain death? If I donate my organs now, I will not have them in the next birth. Would you all believe these things? Brain death is death. Nobody has recovered from brain death. In 1968 was the first time brain death was recorded. And it has taken more than 25 years to give it a legal format for us. Therefore, a lot of work has gone into brain death declaration, certification, before India adopted brain death. Do you believe that if you donate your corneas in your next birth, you won't have eyes? If you donate your heart, you won't have. Our physical body leaves this earth, and we are reborn with a fresh body. That is what we believe. Our country believes. Religions forbid organ donation and transplantation. No religion expressively forbids organ donation. All religions believe in helping others. Basically, so many religions have said, in Islam, it is said that if you save the life of one person, you save the life of an entire village. These are some things that people should know about, and therefore no religion forbids organ donation at all. Organ donation mutilates the body. There is a cut from the chest down for retrieval of the organs, but the body is stitched surgically by very good quality surgeons and given back to the family. They do not even know unless they wish to tell others that organ donation has happened. Now, taking care of myths, would you like to pledge? Would you like to be a part of this cause? Would you like to live after you're no more? So this is how you do it. You register online. You can go to our website and register. You can go to TransTan website and register. You can go to NOTO website and register. One sir had said about National Organ and Tissue Transplant Organization of India. This is in New Delhi. You can go anywhere and register. The main thing is you get a donor card, as I have shown on the screen. Take your donor card, show it to your family, show it to your friends, explain to them that this is your wish. We also have an app called a donor card app. You can check it out on your phone. And now in the Motor Vehicle Act in 2018, everybody who applies for driving license or renewal of driving license has to answer a query whether they wish to be organ donors or not. But with this amendment in the Act, we have been able to reach millions of people. But still, Mohun Foundation is struggling to get it generally spoken of at the RTOs. At the RTO, they don't ask the client whether they want to do, they just say no. So we are now working with the RTO officers that anybody who comes for a renewal or for a fresh driving license should be asked the question that is there in the form, whether they want to be an organ donor or not. So this is how you register as organ donors. That was the end of my talk. A little bit about ourselves, about Mohun Foundation. Our motto is life, pass it on. We have offices in multiple places in India. Mohun stands for Multi-Organ Harvesting Aid Network. It was started in 1997 by a group of doctors who wished to see that there is no illegal organ trade, because there was a lot of rackets at that time, and that's why they started this. One of our greatest activities is public awareness. We do nearly 350 programs a year, and we have a training called Angels of Change training or Ambassadors training, where young people like you can get trained and you can speak about the topic of organ donation to others. This is basically to create awareness. We have a toll-free helpline of which I am in charge. Please take down this number and keep it in your phone, because anytime you have a patient in your house or you have a death in your house, if you wish for us to counsel the family members, we could counsel the family members. That is what we are trained for. We also have a newsletter, which is goes to nearly 1,500 doctors, which tells about organ donation news, national and international. But since we are an NGO and working for the past 25 years, we still have a lot to wish for. Like yours, sir invited Mohun Foundation for a talk. We wish that many more people understand the value of organ donation and taking a pledge. We want to increase the ambassadors program, the interns program. We offer 2-month internship in our offices. We wish to conduct more sessions like people like you with nurses, because you are at the forefront there. You will be attached with some hospitals or clinics, and your word will have some value to anybody whom you treat. We wish to train transplant coordinators. One of the second important activity that we do is we train grief counselors and transplant coordinators. So you could join our online training if you wish to work as a transplant coordinator. And right now, our transplant coordinators and grief counselors are in the government hospitals in Tamil Nadu, Hyderabad, Mumbai, and Karnataka. So we wish that every district level hospital also have a grief counselor. So at least we have enough cornea donations. So there is no wait list for cornea. So that was all I had to talk about organ donation. I hope you enjoyed the talk, and you could call us over here or you could write us to us on the info email ID. Thank you very much. Ready for any questions? If ma'am has the ready with the results of the Google thing, we could also have a look at that, how people think about organ donation.
Yes, ma'am. Shall I share the results now, ma'am?
Yeah, sure. We'd like to see that. %16% believes brain death is not death. Yeah. So I told you that only rich people get organs. That doesn't happen. Every time there is a death, brain death, family gives consent, one organ will go to patient in the government waiting list. 18% said that organs are sold by the hospital. That does not happen. It is all controlled by Transtan, which is in the Omanduran Multi-Speciality Hospital. No organs are sold. For diseased organ donation after death, no organs are sold. Okay, 16% feel they do not believe that brain death is there. Now, after this talk and after Dr. Sandeep Vesh's video, would a lot of you change your opinion that brain death is death? That is also I want to see. Number 9, my religion does not support organ donation. That is a biggest myth that is happening in our country. If your religion allows you to take a transplant, will it disallow you to give a donation? That's what we need to think actually. Does your religion say that if you're a liver patient, please don't take a liver? It doesn't say that. It says whenever you can help, you should help others. Okay? So thank you, ma'am, for this. I hope everybody saw what, the general public thinks about organ donation.
Thank you, ma'am.
Yeah, any questions or anything new? We could take it, okay?
Thank you, ma'am. Thank you for the illuminating and wonderful talk. May I now request Mrs. Gajlakshmi ma'am and Dr. C.N. Hemalata ma'am to felicitate our speaker of today's webinar by sharing the e-certificate as a token of honor and respect.
Thank you so much.
Kindly accept our e-certificate as a token of honor and respect.
Thank you very much for this.
Now I call upon Dr. M. Geetanjali, Assistant Professor, to take over the session further. Over to you, ma'am.
Thank you, ma'am. Thank you, one and all. The best and beautiful things in the world cannot be seen or even touched. They must be felt by heart. Thank you is one such prayer among them. I consider it a great privilege to propose a vote of thanks to all the dignitaries who have witnessed it as a memorable and successful event. I, on behalf of Faculty of Pharmacy, Dr. MGR Education and Research Institute, and the entire fraternity of the college, first of all extend my most sincere thanks to the Lord God. We extend a heartfelt gratitude to our management, Founder Chancellor, Dr. A.C. Shanmugam Sir, Honorable President, Engineer through A.C.S. Arun Kumar Sir, Honorable Secretary through A. Ravi Kumar Sir, our Vice Chancellor, Dr. S. Geeta Lakshmi Ma'am, for their constant motivation, guidance, and rendering us with all possible supports towards the achievement. I must remark a profound sense of gratefulness to our management, to our principal, Dr. N. Harikrishnan sir, for his leading supervision and inspiration at every point of time. Organ donation is something that is more important than people realize. It is an important for society as a whole and as well as for every individual. In this regard, I would like to extend sincere thanks to the speaker of the session, Dr. Hemal Ma'am, Quality Assurance Officer, for adoring the occasion. Your thoughts have enlightened our minds and shown us a new path, ma'am. Thank you all once again for making this program more meaningful and memorable. The participants are requested to fill the feedback form to get the e-certificate.
Ma'am, can you share the last video?
Yes, ma'am. வச்சிட்டு அப்புறமா share. The word minimize பண்ணிப்போம். இத ப்ளே பண்ணிடு.
Hello, my name is Shreya Sittan Gowder and I am a recipient of bilateral above elbow hand transplantation. I lost both my forearms in a tragic bus accident in 2016. After the accident, I tried to use prosthetic hands, but they didn't help me in any manner. That is when I saw hand transplantation as my last hope. On the early morning of 10th August, I got to see my new forearms for the first time. And I cannot express the amount of happiness or even the amount of gratitude I felt when I saw my new hands for the first time. I think I'm truly blessed that I got this chance of having hands again, and I had accepted them as soon as I saw them. But today it is almost 3 years since my transplantation, and I can do most of my work, be it bathing, dressing up, eating, or combing my hair, brushing my teeth, writing my college exams all by myself. So I'm glad and I'm extremely happy that I can do all of these things again. And I just have one message for my donors family, is that this deed that they did of donating their son's organs is really noble, and he is still alive in 7 other people, including me. And this hand transplantation has given me a second shot at life, and my donors family are no less than a God's blessing for me as well as my parents. Thank you.
Thank you, ma'am.
Thank you, ma'am. Thank you for your wonderful talk.
Can I leave now?
Yes, ma'am.
Okay. Thank you so much, all.
Students are requested, participants and students are requested to fill the feedback form that has been posted in the chat box.